in some communities, sometimes it's difficult to have access to them simply because we are not putting our shoes as a member, full member of the community. So I agree we need education, but I think the first step is, first of all, to consider ourselves as a full member of the community we want to serve.
This is Because People Matter, a podcast about celebrating leaders who are harnessing the gift of human differences, creating inclusion while driving success in their organization and communities. Hosted by Dr. Helen Fagan, each episode features interviews with individuals who are leading the way. If you're ready to learn the impact becoming inclusive can have in your business, or wish to hear positive stories of impact, this is the podcast for you.
Hello, friends, and welcome to today's episode. So today I have a chance to sit with someone I have known and admired for a few years now, Dr. Grace. I got to know her when she was participating in our Rural Fellowship Program. Dr. Grace is from the Republic of the Congo. She is an OBGYN. She was working on her master's in public health when I met her. She finished that and is now in the doctoral program. She's an incredible practitioner, researcher, and really making an impact in maternal health in the Congo, in the United States, and just through her contagious energy wherever she meets people. I think you're going to really enjoy hearing her story of how she got started in this and why this is important to her. She really cares for people. So she is one of those people that epitomizes the reason we exist, because people matter. And I'm delighted to have you join in and listen to our conversation. Welcome, Dr. Grace. I am so excited to have you on the Because People Matter podcast. Thank you for saying yes.
Yeah, thank you. Thank you so much, Dr. Fagan, for having me. Such a pleasure. And I'm so honored to be here today with you.
I am equally honored to have you. What I want our audience to know, Dr. Grace, is what inspired you to begin working in or studying maternal child health while you were in the Congo? How did your passion for that get started?
So a short answer to that will be my mother. So as a short story, my mom is a midwife. She's a retired midwife right now. So when I was about 8 years old, my mother has a small local clinic where she was providing maternal and childcare health. So one day it was about, I think, midnight, and it was dark. We didn't have the power at that time. So she asked me to use a candle so we can have the light in the local clinic where she was on duty. And the woman came in labor. She said, "Grace, you have to help me tonight. I have no one else." So she gave me gloves, and I hold the candle, and she was doing the delivery in front of me. And when the baby came out, she said, "Put the candle on the table, take the baby in your hand." So I was there, as a little kid having another baby in my hand. I didn't know what to do. She said, "Try to rock the baby so the baby will not cry." And I tried to do that. And then the baby just stopped crying. I put it in a small basket and waiting for my mom to come and clean the baby. So since that day, that's very first day, I decided to become a medical doctor, first of all, but most specifically working on maternal and child death. So that's the reason why I decided to follow that path.
Oh my gosh, what a powerful, powerful experience.
Yeah.
Wow, that sounds incredibly scary and at the same time so inspiring to watch a young life come into the world. And as a mom and a grandmother, I know the impact of that. And that's wonderful. It's a wonderful story. And I'm so glad you chose this path. So you got your degree to be a physician in the Congo. Tell me a little bit about your work there. and what you did there and how that led to your interest in the research and policy that brought you to the United States to first get your MPH, and now you're working on your PhD.
Yeah. Yeah. So to piggyback on the story that I shared before, so after that moment, my mom said she was calling me doctor, doctor, doctor. I was biased. I couldn't find any other path. So I went to med school, I graduate, and I said, okay, I'm gonna become an OBGYN. And I got a chance to get a residency offer to become an OBGYN. But I wanted to have another experience. And I asked my mom, I said, do you think I should go in rural areas in my country just to see how maternal and child health looks like there? But I didn't have any job offer to get there. And until I get a chance to work with organization, nonprofit called Terre Sans Frontières. So at that time, they were working with refugees who were living in rural areas in a refugee camp. So I traveled to rural areas and I start working providing free medical assistance to refugees in refugee camp. So it was heartbreaking to see how people, live in a refugee camp, how it's hard to have access to the basics. And, so with the effort of everybody, we're providing them everything they need. And this is how I saw the practice of medicine at a different level. I was used to a one-to-one experience with a patient, but in a refugee camp, in a rural setting, I had many people coming at the same time. And at some point, I felt like my work was not enough because as a clinician, I can only save one patient at a time. And I say, maybe I should be able in a position where I can help more people at the same time with one action, one project. So I start Googling online and I discover that there is a field called public health, which is actually, it's like medicine because medicine is more clinical. You're providing a clinical healthcare, but public health, you're providing, I won't say healthcare, but somehow, but at a population level. And I said, this should be something that I will be able to do. And I started applying for scholarship, including the one that I had a chance to get, which was the Fulbright scholarship. And I moved to the United States, started my MPH degree, and learning more about maternal and child health. And I discovered another aspect of maternal and child health, which is it's called life course health, which is in short, a way to tackle the issue of today by studying about the issue of the past. So a woman today having a difficulty or having a particular situation related to a woman's health, we need to start from the early childhood, going to the adolescent health, to the reproductive health until today. So that was another passion, another word that I had a chance to discover. And I had a chance after that to do a capstone, which is it's a kind of fellowship or practical training before graduating for your MPH. And I had a chance to go in rural Nebraska in a town called Valentine. So this is where it was another way for me to work in rural area, but in a different type of rural area. So I think I answered the question. I don't know, but
Oh,
yeah, this
yes,
is a little
yes,
this
yes.
is how I got
Wow,
there until
that's
today.
yes. So from just being interested in women's health, serving women, seeing the implications, especially from like a serving at a refugee camp, the implications of, challenges in rural care, access to care services, to those experiences that shaped you, that led you to the MPH, and then now have led you and your own experiences. You've got rural experience from the Congo, working with the refugees, to rural Nebraska. I can't wait to dive into, that a little bit. But what you were talking about, your MPH, it reminded me when I was working on my doctorate, I took 4 classes from the College of Public Health because, I came from a healthcare background. And they kept telling me that the MPH folks, you're not very far from getting your MPH. You just got to take a few more classes and then do this capstone. Are you sure you don't want to do that? And I was like, yeah, no, I got to finish this PhD. But the thing that I remember from a global public health class that I took, Grace, was one thing that I learned was that you educate a man, you've changed that man's life. But you educate a woman and you have changed the life of a family, a community, and sometimes, far reaching impact. And that has stuck with me. And as you were talking, I was thinking to myself, all the people that will be touched have been touched and will be touched by your efforts and, your mom inspiring you by calling you doctor. I love that. That's so great. So you talked about your capstone with the Rural Fellowship Program. That's when you and I met. You applied.
Yeah.
I was leading that program and you applied. And, part of the piece of that program was we wanted to place international students and domestic students in rural Nebraska to work alongside community leaders. We also wanted to give experience for that inclusive mindset development for both the students that we were placing as well as the leaders that we were placing. And so that's when you and I met. You were in Valentine, Nebraska. And I remember visiting you there and chatting about kind of where you're going to take this and some of the things you shared with me. So tell me, what did you learn from your experience in Valentine, Nebraska that influenced your views on healthcare access for people in specifically rural areas?
So I learned a lot of things in rural Nebraska, but the first thing that I saw when I came to rural Nebraska, the first day we had a chance to go a little bit in the town to visit, and then I don't know how we call him, but the one who was with us, who was taking care of us at that
Your
time.
host?
Yes, thank you so much. So our host was explaining us the issues. He said we have a difficulty with early childhood access here. Sometimes people, when they join to get a job, they have to leave because there is no one to take care of their children. So he tried to explain those things. And I just realized that whether in Nebraska, in the big United States, or in the small Congo in Africa, rural areas facing the same issue, which is disparities in healthcare access. So it's maybe not emphasized in the same way. Maybe it's not the same particular direction, the same domain, but at some point we have a lot of similarities. And that was eye-opening for me to realize, okay, there is a job that needs to be done in rural areas. And in the specific example of Valentine, Nebraska, the issue that we had was related to early childhood access. And then we were all together with everyone in the community, sitting together, talking, trying to find the ways to tackle the issue with early childhood access. And at that time, we realized that we needed to have effective policy. We needed to have effective change, but at the systemic level. Because even if we decide to do something on our own, it's going to be a decision, it's going to have an impact, but not the impact we are expecting. Because when we said, for example, when we were in rural Nebraska, we said, okay, we will start with one house, trying to have a local childcare to help people to have access, at least for the doctors that will come to work at the hospital. We were faced with another issue. That issue was the license for the health educator. But the issue was with that was at some point you need to have a license and you need to go through a very long process to get that license. So even our local solution will not work because we had to face systemic issues that was there is to get the license. So that's how we realize we need to have a policy change. We need to have a bill that are pro early childhood access. So that's how I decided. I said, I'm ready. I want to help rural area, but I need to get another level of knowledge, which is how to advocate for the community using a systemic change, using a policy change. And that's how I switched to a PhD in health services research and policy administration.
Very cool. Very cool. Yeah. So a couple of things I want to explore with you in what you were saying. You saw some similarities, even though the Congo is thousands of miles away from rural Valentine, there's still some similarities, which was access. And so in rural Valentine, what you saw was people could move to Valentine, get a job, but if they have children and there's no childcare, why stay, right? So that's a challenge, especially if you've got a physician that's new to the community, or a nurse or another mid-level practitioner that you're recruiting to the community, you're bringing into the community, but now they need childcare and that childcare is not there. So why stay? You can't work because you don't have the childcare, right? So that was the observation the community made, and they were trying to address it, and you were researching and you were bringing the community together to brainstorm about ideas to address it. And that's the realization that, hey, there's another barrier here. And that barrier has to do with licensing. And so there are barriers that need to be addressed at the policy level, where we're creating to remove those barriers to then be able to address this, have someone there or a program there at the hospital or the local clinic to be able to provide childcare to these team of individuals. So something you said that was interesting to me is, especially from my research and the work that we do, you talked about policy changes as being the necessary thing that you realized. And a lot of the work that we do, that I've done, it's really on that individual level change. It's getting that leader or that physician or that decision maker to begin to think differently, to begin to have an inclusive, we call it an inclusive mindset. What I've seen is, until individuals see the value in that, until individuals have that mindset, they will not create policies that address those types of barriers. So I love that you're working at that policy level, because it connects with what we want to see happen. And we're working at that individual mindset level to bring change. The Institute of Medicine published a report in 2003. This was a long time ago, right? But their findings was healthcare disparities continue since 1950s, 60s, 70s in the United States. They continue to this day. Part of the reason was bias and discrimination on the part of the provider. That was one of their key findings. And when I read that, I was still at Bryan Health. I was leading the diversity cultural competence programs. And I really began to think, how do we shift that? And one of the recommendations they had was providing education, expanding cultural education, bias, unconscious bias, those kinds of training, education, for in medical school, in nursing school, and some of those kinds of things. And one of the policy changes was the continuing education for licensing for physicians. So they're called CME hours. And, for nurses, it's continuing education hours. That in order for you to get your license renewed, you had to show that you were continuing that education. And I thought
Yeah.
that was really interesting because, Dr. Grace, often the training and education that is provided, whether it's medical school, nursing school, wherever, it's here, learn this about people from the Congo, learn this about people from here, learn this about people from there. I have yet to see it be, hey, who are you? What makes you think the way you think? What are the biases you possess and where did you learn that? And to me, that was the piece that was missing in us being able to fully develop that mindset. And so, something you mentioned earlier, there's a common misconception that maternal child health looks a certain way in rural areas. And sometimes it's just too deep rooted to effectively address it. And
So
I think
yeah,
that's a misconception. And I would love to hear your thoughts on that, because my thoughts are we got to change the mindset around that. What are your thoughts on that?
yeah. So yeah. Thank you so much for the question. While you were talking, I was just thinking. You say, okay, we need education. That is a good thing, but I believe that at that individual level, as you mentioned, the first thing we need, first of all, is a little bit of vulnerability. We need to be able to see ourselves as part of that community. That is a step. And I remember when we did the rural fellow, we had a training about
Mm-hmm.
inclusivity or inclusiveness. I
Uh-huh.
cannot know exactly, but I had the feeling that the best way to work with people is to see yourself with those people and to see yourself as a member of the community. I'm not born in Nebraska. I never heard about Valentine before, but I saw myself as a member of that community and I said, I have to work. So even when the education come later on, you need to be able to see yourself as part of that community. And that's also a way to answer the question you asked me just a few minutes ago. It's sometimes when we come to fix an issue, I will call it like that, fix, because as a researcher or someone in power, we think that this is something that is not working. I'm here to fix it.
Mm.
I have a power, I have a certain position, but that's not a way. So I think we need to have a leadership sharing. We need to
Yeah.
have that mutual benefit. So when I'm coming to the community, I need to be humble. I need to be vulnerable to show myself and say, okay, I'm here. I'm here to help. I might don't know how that's gonna happen, but I'm here to help. What can I do? What can I learn from you? And what can you learn from me? And this is the only way we can really help the issue in rural area. And sometimes people don't like doing that. They want to come give orders, do this and
Mm-hmm.
expert point of view. But if I have to put myself in the shoes of the member of the community, will say, we don't need you. You just have to go. And that's why in some communities, sometimes it's difficult to have access to them simply because we are not putting our shoes as a full member of the community. So I agree we need education, but I think the first step is, first of all, to consider ourselves as a full member of the community we want to serve. Because even when we come to help, we are actually serving the community. We are not leading the community. And I believe, the first step of being a leader is to be able to serve, first of all.
Mm-hmm. Yeah. Well, everything you just said just makes me so proud because we teach. Those are some of the things that we really try to get drive home to our, fellowship students was hey, you may have expertise in this, but the community leaders and the community members have expertise in their own community. You have to enter with that level of humility and recognize they're experts in life in that community. And it has to be co-created, it has to be collaborative. And I often see that when, you know, we, and I mean really those who are there to help or serve, have a desire to care for others. You know, we go into another country or another county or another community or whatever, and because we have these initials after our names, because it says we have this education, we forget to remain humble, and we forget to recognize and acknowledge the level of expertise that already exists there, and also that what I know may not work in every
Exactly.
single environment. You know, I've worked with physicians and I've said to them, you are an expert in medical practice. We recognize that, but your patient is an expert in their own body. In order for you to have a positive outcome, you have to, you know, there's that level of cultural humility of recognizing that you know, you've never lived a day in this person's body, so listen carefully. And to bridge that difference, it takes that. So yeah, and we did a lot of activities that required vulnerability in those 2 days of training, didn't you?
Exactly. You know, you have to give something to get something. Like
Yeah.
sometimes I remember when we were little kids, if you want to have a best friend, you have to tell me a secret. And then
Oh
I will
yeah.
tell you my secret. And then that's create a kind of trust because we are sharing both of us something. And sometimes it's something we don't know how to do. And also the biggest issue with vulnerability, we are most of the time vulnerable with people that we feel equal as us. So if I go to a classroom with 5 years old kids, there are things I won't be able to say to them because I feel, okay, I'm older than them. So, but if I have my peers, I will say, okay, I'm struggling here. I don't know how to do this. And that's why it's hard to be vulnerable inside of the community when you think you are better, when you think you have that hierarchy position.
Mm.
But if you think you are equal as the community member, then you say, I don't know how to deal with this issue. I might have an idea, but I don't know if it's going to work. What do you think? So this is a part of vulnerability. Exactly.
Absolutely. And you know, it makes me think of why it was important to have students move into the community, because they had to be able to see themselves as a member of that community. Even if it was for 8 weeks during the summer, you had to be able to see yourself as a participant and experience it there. You can't bring, you know, full contribution until you've done that. So yeah. You were recently selected um, to be a representative from the Congo at the One Young World Summit that was in Montreal, Quebec. Want to tell us a little bit about that? I mean, I think that is amazing.
Yeah,
Congratulations on being
thank you so
selected as a
much.
delegate. But tell me about what happened there. What did you learn? What and how did that inspire you?
Yeah, so for those who don't know about it, Young One World is like it's like a big, big, big party of young people who are just excited, who are engaged in the community, who wants to make the change happen. So it's a summit with more than 2,000 young leader. So in the application process, they really ask you, what did you do for your community? And what was the impact of what you did and what do you think you can learn but also give at the summit. So I shared a little bit of my work that I did with Terre Sans Frontières when I was in rural Nebraska. I explained how even if we didn't fix everything, but we reduced the mortality rate. We were going from at least one maternal death a month, which is a lot. Can you imagine that? And we moved from there to less than 5 maternal death per year.
That's
So
fantastic.
that's a big step. So that's why I get a chance, just to be there, share with the people um what I did, but also to learn from those who are ahead, who are doing more. So that's a little bit the conference, and I was really happy because that conference was really inspiring, to see other people. Like, sometimes when you are on your journey, you do a lot of things. At some point, you might feel tired. You might feel the burden of doing what you are doing, but having other folks of your age doing the same thing, you feel empowered to do more, to do more.
Mhm.
And you have now a networking, you have a better, more people that can help you achieve the goal you want to achieve. You can have practical example of how you can help. And the biggest thing I realized that a lot of people are working on rural areas, saying it was trendy there because, that's
Mhm.
where I don't say that there is no issue in urban areas, but sometimes rural areas are left behind. So it was
Mhm.
really nice for me to be there. And I got a chance to carry the flag of my country. I was the flag bearer for Congo. It's was a lot of emotion at the same time. And I'm really happy that I had a chance to be in part of that summit. Yeah.
Wow. Wow. Yes, to be a flag bearer, and the journey that you've taken, and to be in Canada, it's almost like the Olympics, right? To be the flag bearer in this space and to be inspired by other young people who are equally passionate and driven to make an impact. That
Mhm.
energy, I can just imagine how inspiring that had to be. So how did the conference shape your plans for the future?
So from the conference, when I was going back at the airport, when I was going back to the US and I was at the airport, I said, I need to do something. What can I do? Maybe I should create an NGO. Which project can I work on? I had so many ideas, and right now I'm just trying, and that's why I decided after that conference to get in touch with Terre Sans Frontières, which is the NGO actually working in rural areas where I was working before. I'm not working for them anymore because I'm now in my PhD, but we had a chance to talk and we decided together to start doing research again. So after reading the report, we define 5 pressuring issue in maternal and child health, and we are working on it. It's not done yet, but we will start doing research on those pressing issues. What is not working? What's the research is telling? And what can we do about that? So it's still in the area of health disparities, but we want to have a specific action to a specific problem.
Absolutely. That sounds so exciting. You know, I love that this NGO that you worked with as a physician, as an OBGYN, is willing. It says a lot about who you are and the contributions you made and the contributions you continue to make, Dr. Grace, that they're saying, wow, yes, let's collaborate and let's look at doing some of that research and let's bring forth some solutions based on what you're learning and what
Mhm.
they're giving. So that's beautiful collaboration. It makes me think of some research that I read recently and something that I encourage all international students that I work with. And I always, when in teaching, I would always say, this diversity and inclusion and equity stuff that you're learning about and the leadership and the inclusive mindset, it works this way in the United States. It may not work exactly that way in your country. What I encourage you to do is to look back and say, what part of this needs to look different? And I think about that in the way that we do research. Often, how research is done, where it's published, the language is published in, the culture that it takes is very, US European centric, right?
Mm-hmm.
And so while the process of research and data collection, data analysis, may cross national and cultural boundaries, I think the important thing for us to remember is a solution that may have worked this way in the United States, or a process that worked this way in the United States, may need to be modified to work in the Congo. And I had a recent conversation with a former student who ended up getting his master's degree through, I want to say, NYU. And he lives in the Philippines and works with a program. And one of the things he said was, during my research in Papua New Guinea, I realized that this was a government, a DoD contract. What they wanted to see as positive structural changes was absolutely not the level that the individuals were functioning at in Papua New Guinea. There was a whole different layer of things. And so that's what your response made me think about. What else from the conference, how were you kind of tuned into other barriers as a result of your experience at the conference, and then coming back and collecting data, living in Omaha, collecting data? How did it shape that?
Yeah, thank you so much for your question. So I really like the example you gave about the student, and that's exactly also what we as an international student we face is sometimes the reality of doing research in the United States is different from doing research in Africa. It's two different settings, so we
Yeah.
can't compare that. And each setting has its particularity, each setting has its challenge and barrier. So that's why we talk a little bit earlier about the community, because I can say the United States is a different type of community, right? So the way I address the issue in rural area might not be the way I address the issue in the United States. So for instance, there is the biggest part of research in the United States is really done about racial disparities, which might not be the case in Africa. In Africa, I
Right.
never heard about the race, I even, sometimes we don't even realize we are Black people because it's not a matter to us in Africa. But once I arrive in the United States, I realize that, okay, I'm Black here, and there's white people, there's Asians, so there's different type of race. And as a typical example of that, a couple of days ago, I was doing research because we're doing a research on colorectal cancer screening, and I was ending. So the main goal of the research is to increase the colorectal cancer screening among African American. So the place where we collect the data is at North Omaha office of Douglas County Treasurer. I don't know if you know a little bit that area. Yeah, so it's part of North Omaha. So when I was collecting my data, I saw a white couple just passing, and they were laughing, and I said, "Oh, I had the feeling they were laughing at me," and I said, "No, that's just my thought." Because when you have been exposed to racial issues for a long time, you tend to be sensitive. Anything that someone from another race is doing, you might think is doing that because I'm Black. I said, I don't want to be judgy. I said, no, I'm not gonna do that. So they went inside, they did what they have to do. When they came back, they saw a piece of, like they saw a coin, a penny, like on the ground. They pick it up and they came and handed it to me. I said, why are you giving this to me? Oh, they say, we think you might need this. I say, why I need that? They say, yes, you might need this. So it took me a while to realize that they were actually, for them, it was an act of charity, like they were feeling, okay, this is a Black girl in a Black home in North Omaha area. she's probably, they didn't, I even think that they didn't even pay attention that I was actually doing a colorectal cancer screening, but they just saw me as a Black person. So they just saw me there. They didn't care about anything else. They said, this girl might needs a penny. And when they left, at that point, I didn't know what to do. I didn't know if I have to follow them and ask them, this is very rude. Why did you do that to me? Or if I have to stay. Like I was in a shock because I couldn't imagine that someone would just do that to me and for no reason, right? And some people, some people say that, giving a coin, it's a lucky charm, but contextually, I know it wasn't in that context, because the way they talked to me, the way they gave me the penny, and I even asked them what was the reason of giving me that. So if it was for a lucky charm, they would have told me. And you can feel when someone is wishing you luck and when someone is trying to insult you. And I really felt insulted. I felt diminished. I felt embarrassed at the same time, because people were coming in and out at Douglas County. And it took me a while to know how to deal with this feeling, because I never experienced that, very explicit racism like that before. And I just decided, okay, I'm going to take time just to, you know, to assess the issue, let it go, let my anger go away. And one of the way I found is to share that with other people, because I say, okay, at the beginning I felt hurt. And after some times I realized that's the reason I'm doing what I'm doing. That's the reason why I'm working on health disparity. I have to share that. I have to talk about it. And that's why I'm talking about it here, to say, okay, these type of things happen, but I'm not gonna stop there. I'm not gonna retaliate, like follow them and insult them. Fine, no, I'm gonna work on my research. That's the best way for me to help to reduce disparity. There is a lot of way to address racism, but the one that I follow, that I decide to follow, I decide to use, is to use my knowledge, my medical knowledge, my background, to try to reduce health disparity related to your race. So I
Mm,
decided not to be judgy, not to judge people because of the color of the race, but I decided, first of all, to be a human being, and second, to give the help that I can provide to the research that I'm doing.
mm. Wow. Wow. Gosh. First of all, I just want to say I am so sorry that happened.
Yes, thank you.
Um, they lost out on getting to know a brilliant, compassionate world changer um, by their own limitation, their own bias, and the things that were making them behave. That is not acceptable. As human beings, we have to do better. We have to do better. Gosh, I am so sorry that happened. I'm so proud of you, so incredibly proud of you for the way that you are using this as kind of I see an image of like a road that is built with bricks, right? That someone is paving the bricks. We can either become angry and diminished and feel devalued, and we do, and we acknowledge that. And at the same time, it is the resilience, it is the grit, it is the fortitude in you that says, nope, they threw this brick at me to diminish me, but I'm going to take it and I'm going to put it down and I'm going to use it as a paver to pave the way for my research to get out there, because disparities continue and they begin when things like that happen, when human beings
Exactly.
treat each other dehumanizing ways. So thank you for sharing that story. And thank you for doing, the research and the work that you're doing, Grace. I believe our world is better because of you. So
Yeah.
thank you.
You're gonna make me cry right now.
Uh, your mama should be so proud of you. I'm sure she is. I am very proud of you. So tell our audience, where are you going to be presenting your research next? Where can we hear you? Where can we learn more about Dr. Grace and the incredible work she's doing?
Yeah, so right now the work I'm doing, it's always around health disparities, but this time we are working on how to integrate doula within the health system of care. So it's actually a way to reduce also health disparity related to Black maternal mortality in the United States, and using doula as a, liaison between the
Mhm.
community represented by Black mothers and the hospital. So I have a research going on that. It's still going on, but we conducted the first study, which is a qualitative study, just discussing about the facilitators and the barriers of integrating doula within the perinatal system of care. So I will have the chance to share the finding of this research at APHA, American Public Health Association annual meeting in Minnesota. So yeah, that's the next step, and I'm excited to see what's gonna happen after that. But I'm working on doulas right now.
That is fantastic. So what your mother did in the Congo as a midwife, you're looking at how do we integrate the role of a doula, which is, I know it's different from a midwife, right?
Mhm.
But in similar kind of support, the support for the woman to have a healthy birth, right? How do we use a doula to help reduce the mortality rate,
Uh-huh.
both women and infants in
Uh-huh.
African American communities in the
Yeah.
United States?
Yeah.
American Association, Public Health Association in Minnesota conference. You're going to be sharing your research. That's fantastic. And if our listeners want to follow you, what social media platforms do you share content? Do you share information on that we can share with our audience?
So I mostly use LinkedIn. So that's my favorite platform I use most of the time. But right now, as I mentioned before, we're working on research in rural area in Africa with Terre Sans Frontières, the nonprofit organization. So we will be doing research. So all the findings, all the report about the research will be shared on the website of Terre Sans Frontières. So those are the two ways you can know a little bit of what I'm doing. And of course, as a UNMC student, any project related to academia that I'm doing with my advisor will also be shared on the UNMC website, and sometimes on social media as well, like LinkedIn. Yeah.
Fantastic. I am so excited. And I'm excited to watch you earn that PhD and
I
to
will
watch
invite
your journey.
I will
Yes,
invite you,
please
Dr.
do.
Baker. Yeah, you have to be there.
Please do. I will come and I will cheer you on. And I'm excited to continue to follow your path and see how you continue to change people's lives. Thank you for giving your time. I know you're busy with your research and your academics, and I sincerely appreciate the time that you've given to us today.
Thank you so much. It was a pleasure. It's a first nice experience. So I'm really glad having this time to talk with you. It's always a way to learn. So thank you so much.
Thank you.
This has been Because People Matter, a podcast about celebrating leaders who are harnessing the gift of human differences, creating inclusion while driving success in their organization and communities. You can find links to any resources mentioned in today's show notes. If you enjoyed this episode, be sure to subscribe and leave us a 5-star review. Thank you for listening. Because People Matter is brought to you by Helen Fagan and Associates. We are changing the world one inclusive leader at a time. Go to helenfagan.com to learn more about what we can do for your organization.